Now, back to Canton's Morning News with Pam Cook on WHBC.
When you talk about kids and bullying, you think about how upsetting it can be for the child and the family and everyone involved. But what about down the road? What happens down the road? On our WHBC Newsline right now, we bring in Dr. Taaka Cash, psychiatric mental health professional specializing in child, adolescent, and adult psychiatry. Good morning.
Good morning. Thank you so much for having me.
We're glad to have you. This is a topic that so many people think about. Many are experiencing in their own family and dealing with it. But when I saw this new research that, beyond what happens in the immediate time, looking to the future, it can have an effect on a child as well. Tell us about what this new research reveals.
This new research reveals that there's an increased risk for heart disease and diabetes, and increased risk for psychiatric disorders when they become an adult.
And why would that be? Why would it have a long-term effect on them?
Because due to the prolonged strain on the body, your body goes through fight or flight. And so over time, hypertension is the silent killer, and then it affects your lungs, it affects your heart, it affects your kidneys. And so what we start to see, especially on the psychiatric realm, is that when we're getting these lab results, that there's a higher correlation between your physical well-being and your mental health and well-being.
Right. A lot of times doctors will tell you how dangerous stress is. You may be going through a trying time and not even realize how it's physically affecting you.
Correct. Your body eventually will exhaust out. It changes your hormone levels. It changes the way your body metabolizes things. It causes inflammation. And then not only that, it leads to depression, isolation, hopelessness, helplessness, increased risk for suicidality as well.
So how do you recognize this in yourself or in your child?
Well, if you start to see most kids that I treat in my clinic, they'll start acting out. They'll start, with a little bit of irritability, with being withdrawn, with isolating themselves, or even acting out in school, not paying attention. And most teachers, they will misdiagnose this and say, hey, this child actually has ADHD, when in all actuality, it could be something else that they're dealing with.
So, as a parent, what do you do? I mean, you can be at a loss when you come to a situation like this.
Exactly. We teach children, and we teach parents as well, the entire family, to tell your children to stop and think before they do something. Stop and think before they hurt someone. Learn to emotionally regulate yourself. If they're feeling like someone is being mean to them, go to a trusted health professional or even your teacher.
And I would say if you get the situation solved and they're on the road to recovery, then you have to really push the fact that they've got to maintain that healthy lifestyle.
Exactly. Maintenance is very important, and this is something that I stress across the life spectrum, whether you're a child, an adolescent, or adult. Maintenance is very important. Medication is only for symptom management, but effective coping strategies in order to improve emotional regulation and also your physical well-being is the most important factor here.
I think one of the hardest things about bullying these days is, it used to be when I was a kid, it was somebody would approach you on the playground or whatever, and you could avoid them. You knew who it was, you'd walk away. But when it comes to cyberbullying these days, that can't happen. Sometimes it's hard to avoid.
Right. I mean, a lot of these kids are feeling like they can't escape it. They're feeling like, hey, if I pick up my electronic, if I go online, I'm seeing it everywhere. And so in our clinic, we're actually seeing a large volume of kids who are going through bullying at school, and there's a higher incidence of suicidality amongst those kids, as well as self-harming behavior such as cutting.
So any advice for parents, like what's the first step? If they realize this is happening or have an inkling that something like this might be happening, what do they do right off the bat?
Go to a trusted professional. Bring your child in. It doesn't necessarily mean that your child has any type of mental limitation or any mental diagnosis at that point. You're just coming in to get an assessment. It's better to teach a child their early stages as opposed to when they become adults and you're dealing with the physical problems of chronic disease as well as mental health limitations.
And Dr. Cash, what are kind of questions that you can ask of kids? Maybe if you're not certain, you just want to ask them a few things and kind of get a grip on where they might be. What kind of questions should you ask them?
Ask them, how are you feeling? If they're acting out, what are you trying to communicate to me? Some kids isolate. Some kids do not want to talk. Some kids go to their room. Some kids, they will put their hands on someone. Ask them how they're trying to communicate. I actually tell my parents in my clinic, use an emotion chart. A lot of kids that they measure their feelings into good or bad. So they don't even know that they're feeling anger, despair, hopelessness, helplessness, rage. You have to differentiate and help them differentiate their emotions and actually what they're feeling.
All right, a lot of good information. Dr. Taaka Cash, we appreciate your time this morning.
Thank you so much for having me.